8 initial signs of bone cancer you should never ignore if you're over 50. You know that some pains become part of the routine. But what if that constant discomfort in your knees or lower back was more than just a minor annoyance? Today, we'll show you 8 signs of a type of cancer that grows silently in the bones and can put your life at risk if not identified early. Pay special attention to sign number 5. Many people confuse this sign with arthritis, which often delays the diagnosis. Sign number 1. Swelling and sensitivity. Unlike common swelling that can occur due to a superficial injury or temporary inflammation, swelling related to bone cancer tends to be more persistent and often causes pain when touched, aggravating discomfort in daily activities. Additionally, the affected area may become quite sensitive to touch, making simple activities like getting dressed or moving around more difficult and painful. This sensitivity is different and not related to other recurring issues like minor inflammations or wounds. Instead, it is continuous and can worsen over weeks, indicating a more serious condition. Sometimes, there may be a feeling of warmth along with the swelling, which is also a cause for concern. Therefore, if you notice these changes, it is important to seek medical help as soon as possible. By examining the area with clinical tests and imaging, the doctor can identify or rule out the presence of bone cancer. Sign number 2. Palpable lump or mass. The appearance of a palpable lump or mass in the body, especially near the joints or in specific bony areas, can indicate something more serious than a simple cyst or swelling. This nodule may gradually grow and become visible or noticeable to the touch, often accompanied by a feeling of hardening in that area. As it increases in size, it may start to press on nearby structures, causing discomfort or even constant pain, even at rest. Many people expect this type of formation to decrease or disappear on its own, but if it persists, grows, or causes progressive pain, it becomes essential to seek medical clarification. Evaluation through X-rays, CT scans, or MRI is crucial for detecting possible abnormalities in the bones and surrounding tissues. Sign number 3. Reduced mobility. Reduced mobility, when related to bone cancer, can manifest subtly at first through minor difficulties in performing movements that were once simple, such as bending down or climbing stairs. Gradually, even walking or lifting light objects may require more effort, bringing a feeling of stiffness in the joints and less control over the affected limbs. This limitation does not always come with intense pain initially, but it tends to worsen over time, drawing attention to the need for investigation. As the tumor grows or inflames the area around the bone, stiffness can increase, resulting in a reduced range of motion and even a gradual loss of strength. Some people may need to rely on objects like handrails and chairs to maintain balance. In more advanced cases, discomfort can be so pronounced that it affects even routine tasks like getting out of bed or getting dressed. Sign number 4. Bone fragility. This fragility often arises due to changes caused by the presence of the tumor, which affects the internal structure of the bone, making it less dense and capable of supporting the body's weight or daily activities. There may also be inflammation in the area, exacerbating discomfort and making mobility difficult, leading to constant concern about avoiding sudden movements or falls. In some people, the first warning sign is a fracture that occurs suddenly without any apparent reason. Sometimes, a minor impact or a simple abrupt movement can result in a crack or break in the bone, drawing attention to a problem beyond a common accident. Sign number 5. Persistent bone pain. Bone pain associated with bone cancer usually presents as deep and constant, unlike common pains that come and go or improve with rest. It may feel like it's coming from within the bone, persisting even during rest and often intensifying over days or weeks. Additionally, it commonly worsens at night, disrupting sleep, and does not respond well to conventional pain relievers, highlighting the need for investigation. It can be confused with arthritis or osteoarthritis pain, but the difference lies in the intensity, persistence, and pattern of worsening without apparent cause. Therefore, if the bone pain does not subside, do not wait for it to disappear on its own. Seek a healthcare professional to take care of you and ensure your well-being. Sign number 6. Extreme fatigue and exhaustion. Instead of improving with a good night's sleep or short rest periods, this feeling of exhaustion can persist or even worsen, affecting both physical and emotional well-being. Often, The person may feel that getting out of bed or maintaining a daily routine becomes a real challenge, accompanied by a lack of energy and even a loss of interest in previously enjoyable activities. This condition can result from several combined factors, including chronic pain, the body's reactions to the tumor, and possible nutritional imbalances. Even moderate effort, such as a short walk or cooking, can cause disproportionate exhaustion. Additionally, if there is inflammation or changes in blood cell production, the body can become even more vulnerable, leading to progressive weakness and muscle strength loss. Therefore, if fatigue persists for weeks and does not respond to rest, hydration, and a balanced diet, it is essential to seek a medical evaluation. When diagnosed early, treatment can restore energy and quality of life, allowing the person to resume activities without the constant burden of fatigue. Sign number 7. Unexplained weight loss. Unexplained weight loss, without a deliberate change in diet or exercise routine, can be an important indication that something is wrong in the body, including the possibility of bone cancer. Often, the person may notice clothes fitting looser or a thinner face without having made any effort to lose weight. This symptom can occur due to the tumor itself, which causes metabolic changes and demands more energy from the body, leading to increased calorie burning. Additionally, the wear and tear caused by chronic pain, possible loss of appetite, and inflammation that may accompany cancer contribute to accelerating or worsening weight loss. Sign number 8. Fever or night sweats. Some people may notice that, for no apparent reason, they start having fever spikes at night or wake up drenched in sweat, even on cold days. This situation frequently comes with daytime fatigue, as sleep is disrupted or impaired. These symptoms can occur due to changes caused by the tumor in the body, affecting the immune system and metabolism, causing internal inflammation. If these manifestations recur frequently, drawing attention due to their intensity and frequency, it is essential not to underestimate them. The earlier the diagnosis, the better the chance of starting the correct treatment and maintaining quality of life. Now that we understand the signs that may indicate bone cancer, let's move on to a very important part: what to do to prevent it. 5 measures are crucial for this. The first is to know your family history. Talking to relatives about diseases that have occurred in the family is not always easy, but understanding this history can be crucial. Some types of bone cancer have genetic components, and being aware of the past can help your doctor consider preventive exams or closer monitoring. If bone cancer or other hereditary diseases have affected your parents, grandparents, or siblings, share this information during your consultations. This ensures a more comprehensive evaluation and allows for the adoption of personalized prevention strategies. The second measure is to avoid unnecessary exposure to radiation. You have probably undergone various imaging exams throughout your life, but it is important to remember that radiation can be harmful when excessive. X-rays and CT scans are essential for accurate diagnoses, but try to have them only under medical recommendation. If you work or live in environments with radiation sources, always use appropriate protective equipment and follow safety guidelines. Each precaution taken reduces the risk of cellular changes in the bones, helping to prevent tumor development. The third measure is to monitor pre-existing conditions. Some conditions, such as Paget's disease, chronic arthritis, or osteoporosis, can weaken bones and, in some cases, increase the risk of more serious injuries. Therefore, if you have already received a diagnosis related to bone health, it is essential to maintain regular checkups to evaluate the condition's progression. The doctor may request imaging tests regularly to detect any changes in bone structure early. This way, potential complications are identified from the beginning, when treatment is usually more effective. Now, let's move on to the fourth measure: maintaining a healthy lifestyle. Taking care of your body and nutrition is one of the most important steps in protecting your bone health. Consuming foods rich in nutrients, such as fruits, vegetables, legumes, and lean proteins, helps strengthen bones and the immune system. Additionally, regular physical exercise, especially activities involving small impacts or muscle strengthening, contributes to keeping bones resilient. Avoiding smoking and reducing alcohol consumption also makes a difference, as these substances affect circulation and bone tissue quality. A well-cared-for body, especially after 50, responds better to potential threats like bone cancer. Lastly, the final measure is to focus on early detection. Even with all precautions, bone cancer can manifest silently. Therefore, be aware of signs such as persistent pain, unusual swelling, or fractures that occur without significant impact. If any unusual symptom catches your attention for more than 2 weeks, seek medical help. Tests such as X-rays, MRIs, and in some cases, biopsies, help quickly clarify possible problems. The earlier the diagnosis, the better the chances of successful treatment and maintaining quality of life. If you've been with us so far, you surely care about your bone health, right? So, click on the video appearing on your screen now and discover 6 foods that contain more calcium than milk and will undoubtedly strengthen your bone structure. Thank you very much for your attention, and may God always bless you.